Jackie, welcome to the podcast. I'm so happy that you are here because this is what you do in a school community and especially around the state of Idaho. I don't think a lot of people know about. I mean, I didn't know about. And so I'm so glad you're here that we get to talk about it today. So Jackie Yarbrough, you work for the Blue Cross of Idaho Foundation for Health. And I don't actually know what your title is. What's your title?
I'm a senior program officer at Blue Cross of Idaho Foundation for Health.
Okay, awesome. And we met, I think the first time that we met was at the United Way Treasure Valley kickoff of the Rural Schools Initiative for their community schools program. And that was out in Marsing, right? That's where we met?
Yes, absolutely. I helped pull together a host of folks to come out and learn about the Rural Expansion Grant. And, Idaho receiving that grant is such a big deal. The $46.5 million is going to be transformative. And I wanted to pull together all of the right folks so that they understood what this money will mean for our rural school districts across the state and help folks also understand the great work that's occurring in Marsing and how that can be replicated.
So before we dive into that, I want to talk about what the Blue Cross of Idaho Foundation for Health is, and then what you do, how you got there. I am I love the story. I love the story. So you didn't start out there. Where did you start out in Idaho? Where are you from and how did you get to the Foundation for Health?
Sure, absolutely. Well, I was born and raised here in Idaho. I grew up in Hagerman. I moved there when I was 2. After, graduating from high school in that community, I went to college. I graduated from Idaho State University with a bachelor's in social work. And then went on to get a master's in public administration from ISU with a focus on nonprofit program management and development. But I guess part of that story really is I started as a child protection social worker. I did that for 5 years, and that's a really hard job. Definitely a lot of pressure for someone so young coming out of college. I learned a ton. I think that it was foundational for my work as a social worker, but I knew that I really wanted to get into prevention kinds of services to help children and families really, avoid getting into a situation where they needed to have that kind of help and assistance. So after my, 5 years in child protection services, and I held a lot of roles in CPS. So I then started with Pocatello School District, and I was a community resource worker, a social worker in the district for 10 years. And that's also at the time I finished my MPA.
Oh, wow. That's awesome.
Right.
So did you grow up going to the fossil beds in Hagerman?
I did.
Because you see those signs on 84.
Absolutely. And one summer I was actually a tour guide at the Hagerman fossil beds.
So you know all about the Hagerman fossil beds. Tell people why they need to go stop at the Hagerman fossil beds while they're driving along 84.
So it's easy to miss. I think that a lot of folks are either driving through Hagerman to be a part of the, scenery and, just all of the amazing things in the Hagerman Valley. But the Hagerman fossil beds are really a hidden gem. And you need to get off the path and, go check it out and explore. But the opportunity to be out there and see the dinosaur bones and, well, not necessarily the dinosaur, the bones. And also, oh my goodness, just the fact that is here, it's accessible, you can go do it. Folks just don't know that that's available to go see. I mean, I said dinosaur, but that's not really the right way to talk about that.
Well, I think that there's so many cool things in Idaho, though, because earlier you were telling me that you have been around you grew up here in Idaho, you've been around the entire state. I feel like I've been around the entire state. I just did this tour over the summer where I started here in the Treasure Valley and went west and then north and then down the side a little bit into Montana and over to, as far east as Rexburg and then back down through 84 and stopped off in some rural communities. And I've also been up through Chalice and, taken along there. But as you were talking, I was like, oh no, Jackie's really been to all these communities in Idaho.
True, true. So after wrapping up, my time in the Pocatello School District, I was actually hired for the Idaho Food Bank to be, overseeing statewide programming and services. So I joined the food bank in 2008, and I was with them for a little over 12 years. And that role grew during that time, but as I was a part of building out the emergency food access system in our state, I traveled all over the state. I've been in every county, all of Idaho's 44 counties, and honestly, I could say I've probably been in 95% of Idaho's communities. I've been to Elk City, literally the end of the road. I've been to many, many small towns, and having grown up in rural Idaho, I really understand the differences and the challenges that our rural communities face. But I love Idaho, and we are so lucky to have the opportunity to be here and really be a part of this great community. So I love Idaho. I'm so proud to be an Idahoan.
I love that. Okay, so a couple of things. One, as you started out as a social worker in the Pocatello School District, how did that, I mean, you're a rural girl and then you moved to Pocatello and it's not a big city, but it's not rural. What types of things did you learn through that role about your school community?
So being a school social worker was an amazing experience for me. I was placed in high poverty elementary schools, so high Title I schools. Always, that was the goal of the position. At the time, those positions were a partnership between the Idaho Department of Health and Welfare and Idaho Department of Education, and so they were a quasi type position. Really to focus on prevention and helping families get access and connected to what they needed when they needed it, and really prevent child abuse and neglect. But the bigger piece of that was helping families become independent and self-reliant, and they just didn't sometimes know how to find or connect to the services that they needed. A huge piece of that was community and family engagement and building that bridge between home and school. So even back in early 2000, that was a focus, that was a priority. And I truly believe that that is who we are as Idahoans. And that's why the program was so important and so successful. Some changes occurred with that program, and the Department of Health and Welfare was no longer able to provide funding for those positions. And they were all over the state at that point. And some school districts could not pick up the financial cost of those positions. And so many of them went away. What was interesting in the Pocatello School District at that time, and I was in my master's program, I was a part of grant writing to find some bridge funding while the district was able to identify where they could continue to fund those positions through their budget, and mostly it was under Title I dollars. But yeah, that was the journey with that program and that position, and those positions still exist in the Pocatello School District, which is pretty amazing. We're talking many years later.
Yeah. So what then? So you went from there and you went to the Idaho Food Bank, and you're traveling around and you're experiencing these rural communities. And I kind of want to at first kind of like bridge this idea between, because people don't really necessarily understand funding. I plan to have someone on the podcast where we can really break apart school funding, because I mean, you just mentioned sometimes like the school district will use Title I funds, which are funds from the federal government that are coming into every state, to Title I schools. And a Title I school is a school that has a large percentage of students that are on free or reduced lunch. That's kind of a very simple designation for that. So schools have to, when funds come in, they have to it's designated for certain types of categories. So they're using those. But then what does it mean then? I mean, taking this idea of what you're talking about, where like the Department of Health and Welfare were no longer going to be able to pay for these positions around the state for school districts to have this position. And then we've got some school districts, probably mostly rural, who cannot afford to pay for those positions. What does that then mean for those rural school districts when that position goes away?
Well, what happened across the state when that occurred, and I would have to look up what year really that was. I know that I left Pocatello School District and went to the Idaho Food Bank in 2008, and then it had to have been 4 or 5 years before that the funding for those positions was changing. But what that meant for many of our communities across the state and the school districts and the families was that connector person, that social worker, that trusted person in the community that supported home and school was gone. And for the districts that were able to figure it out or find a way to continue those positions, that meant utilizing Title I dollars. That meant, well, at least those positions were eligible to be funded through Title I dollars. But many times they would have to have used general funds to, backfill and support the rest of that position. And then, ultimately it just needed to become a priority within the budget. But when you have a small district working on a small budget, and you have a small Title I program, those funds are getting utilized for direct support and services for kids in regard to reading and math. And so those are hard choices. And many of those positions were lost across the state. And so, yeah.
Yeah. Well, and one of the things that I think about when I hear something like that, when we have our our schools, we have, we have the principal and a counselor, usually sometimes like a traveling nurse that'll go from, different school to different
school. If the district's lucky.
Yeah, if they're lucky, they can have those. We've got, teachers and custodians, other staff, bus drivers, lunch ladies, all the things, we have people in all those categories who are like doing role specific jobs. And we know that schools, and this is just kind of the way that community has been set up in like around the nation. It's not just here in Idaho, but our schools really are kind of at the epicenter of a community. Mm-hmm. And that is where a lot of resources navigate through. Right? I mean, we're working on a bill right now that is going to help educate parents on the limits of technology. And the school, because they're issuing the device, is the avenue through which we're going to be able to educate parents on that, right?
Right.
So my point in all of this is that like we have teachers who are teaching, right? We have principals who are leading the school. We have counselors who are helping kids, work through all sorts of different, things that are going on in their lives. And it feels like, and I've seen around the state where schools can't have this role, there's a social worker whose job it is to focus on that particular bridge between home and school. And so when these rural schools don't have that, they don't have someone who is in a role specific job whose job it is intended to help create those bridges.
Mm-hmm, mm-hmm.
And then our rural communities or whatever communities there are, they don't have to be rural. They can be, our urban communities too. If they can't afford those positions, then they don't have someone who's like building the bridges. And there really just are some natural consequences that come, I think, because of that. So this kind of ties into some of the work that you're doing this idea, right, ties into like what you're doing at the Foundation for Health. So you are at the Idaho Food Bank. Let's just finish the story. And then you go from the Idaho Food Bank to the Foundations of Health?
Well, actually, there was a year, and it was during COVID. I left the food bank. I actually was working with a free clinic and helping to bring free healthcare access. Actually, that my work at the Idaho Food Bank introduced me to Marsing. When I moved to the free clinic, I actually helped bring a free clinic out to Marsing because of that relationship that I had built with the administration and Norm Stewart. I vote for Norm for president any day. He's amazing.
I agree.
But it was really the vision and the leadership out there and just that team. And I love the Marsing community. And it was just an easy way to bring services that were truly, and very needed out there. And then when I left the free clinic, because COVID had kind of shut our work down, and it wasn't as easy to go out and bring free healthcare. I had this opportunity to join the foundation team. And for me, it was just a really full circle moment because I was back to really looking to lead, guide, and build strategy around how could the Health Foundation expand their work in the education sector. And so I just feel like I'm at home. This has been really just such a joy to be able to work with school districts at this level. And I love what I get to do every day. So, yeah.
So I had never, like I mentioned, I'd never heard of the Blue. I mean, I know what Blue Cross is, but I hadn't heard of this foundation that they set up. And as you and I have been talking over the last like several months, I've learned and gone to the website too
Sure.
about the mission of the foundation and the focus. So will you share what those are?
Absolutely. The mission of the foundation is really in Idaho for Idaho, and the focus is addressing the root causes that impact health. We really want to have the best health outcomes for Idahoans, and the foundation was created by Blue Cross of Idaho. It was set up, and it's a private, independent foundation. So we are partnered to Blue Cross of Idaho, but they don't direct everything that the foundation does. We are really just established and set up with that priority and purpose to serve the needs of all of Idaho. And we are statewide. Our funding is in Idaho. It's for Idaho. And we've been able to do some really great things. There are focus areas for community, obviously the education sector that I lead the work, and then we focus on healthcare as well.
Yeah. So I went to the website and looked up some of these things because I was like, okay, I know they've got 3 areas here, community, education, and healthcare. And I thought, what specifically, is happening in these different areas?
Mm-hmm.
So the community one, I thought, I know that you don't lead you lead out education,
Right.
but I kind of thought we could talk about each
Sure.
one, right? Just so that people could be aware of the types of programs that are being supported, and then also how potentially they can help tap into some of these programs for their school communities and their communities in general,
Absolutely.
right? So community, I was looking these up, like there's initiatives, like there's the Mayor's Walking Challenge, there is the Community Transformation Grant, the Community Project. What are these things and how do you choose what your initiatives are?
Absolutely. So Courtney Frost is the senior program officer, my counterpart at the foundation, and she leads the work in the community sector. Her role is really working with communities, local elected officials, to learn about how they can impact health in their community and understanding the connection of that. And so, yes, there are several initiatives under the community focus area. You mentioned the Mayor's Walking Challenge. The Mayor's Walking Challenge is wrapping up right now. The month of October is when we challenge and encourage all of our mayors to walk in their communities. First of all, we want them out and we want them walking and seeing what's happening and looking at accessibility and walkability within their community, but also that gives them an opportunity to potentially go walk with kiddos at school. And they earn money based on the amount of steps that they can complete every day. And so they can earn up to $500 or $1,000 at the end of the month to go towards a community health project in their community, a project focused on health. The second part of that, and I feel like this is one of the coolest programs I've seen in a really long time. And it's called Community Health Academy. And Courtney leads that work, and she brings in content experts to work with mayors. So mayors apply to be a part of Community Health Academy. I believe this last round had 18 mayors. It could have been 16 because she's been growing the project every year. But they come, they participate in Community Health Academy. It's a 6-month academy where they are learning about all of the factors that influence health in the community and how the mayors and local elected officials could be taking that information and applying it in through their lens to their community. So there are large communities that are participating and there are small communities that are participating. And the amazing part of that is they all get to learn from each other as well. So we've had mayors from all the way from northern Idaho, obviously here in southwest Idaho, and then eastern Idaho participating in this project for a long time. The goal is really to have at least a third of all of Idaho's cities having gone through the Community Health Academy, and Courtney is definitely reaching that goal and continues to move the work forward. But they focus on really this year they brought in a new topic of youth behavioral health. And we were hearing youth behavioral health cross all sectors of our work. And so it was really nice to bring in Dr. Megan Smith from Boise State University and Communities for Youth to talk to mayors about community's role in youth behavioral health. The other areas really focus on walkability, bikeability within the community. Also taking a look at their presence. Like it's not just about parks. It's about how do they lead in the community? How do they look at food systems? All of the parts and pieces that come into that. So it's been an amazing program, and I always kind of look to that and go, okay, how do I take this and also apply that in the education sector? Because I think there's really great nuggets of information there.
Yes. One of the things that I love about what I'm hearing and the work that's being done is that there's so much bridge building occurring, meaning that when we have different problems that are occurring in our communities, and that includes education, healthcare, even like all of the different areas, it's about, I think, well, in this particular book, it talked about how when there's someone in the work that sees the problem, understands what the problem is, and then brings people together to understand the problem and then address it in all of the areas that they are in, those individual areas, that's when really beautiful work occurs. And it feels like that's what the foundation is trying to foster in your realm. Would you say so?
Absolutely. I think in the sphere of the work that we try to lead across our state, we recognize that this doesn't happen in a vacuum, and we can have the best ideas possible. But if we don't have partners in that work, if we don't have communities, wanting to learn and listen and bringing in full representation of their entire community, the work will go nowhere. And I think that's been, the really, really fun part of being a part of this team, because there's a lot of thoughtfulness, there's a lot of intention, and we truly care about what's happening in our state. To kind of finish the work in the community sector, there's a really great program called the Community Project. So after the community teams have completed the academy, then they could be moved on and eligible for another grant to do great healthcare or health related work in their community. It's not necessarily focused on healthcare. It's really about how can they create a healthy space in their community. And then the community transformation grant is like the epic grant, where there are a lot of funds that go to support work over a 3-year period of time that help transform a community. But it starts with hard work, listening, really being able to assess a problem, agree on what, opportunities there are to make things better in the community. And it's an amazing process. So it's all full circle. It really, it's a pipeline of the work and services that occur through the community sector.
I'm going to ask my mayor if he's participated in this program, because I want to know if he's thinking about
Who's your mayor?
He's Brad Pike.
And
Eagle.
In Eagle. So actually, yes, the Eagle mayor has been participating.
I love to hear that.
That's fantastic. And he's been a part of the Community Health Academy this year.
Oh, that's wonderful. I'm really glad to hear that.
And I talk to him about that. For sure.
He's going to come in on the podcast. I want to talk to him about
what does he do? What did he gain from Community Health Academy?
I'm going to do that. And I hope that other people reach out to their mayor and see if their mayor has participated, because to me, that then says that their mayor is a learner. And we need people who are learners in that role, and also noting that they're not the experts on everything. We have to bring people in to help us in what we're doing. Well, I love that.
Our theme this past year through the foundation has been the power of listening. and, not thinking that we know what the problems are in our state or that we know how to solve them. I think it really comes back to listening, building relationships, and really leaning in to support communities where they are. And, we hold those as high values.
You're like speaking my love language, Jackie.
Yay!
I love it. I love it. That's awesome. Okay, so let's move on then to healthcare. I mean, I care deeply about the healthcare field. My husband's a physician. I've got a couple of kids who are interested in this, and admittedly, I want my kids to come back and work in Idaho. And you and I both know that Idaho needs healthcare workers. And it was interesting because I was telling one of my kids about the shortage of like OBs in the state and how it's so important for women to be able to have access to a great OB, particularly like, when they're pregnant and doing all those things. And so I was telling my daughter this, and she was like, that makes me want to help women in Idaho. It kind of makes me more interested in that OB stuff and, going in there so that, and I just think like, yes, we need kids in Idaho who are aware of what the needs are and see if their interests align with those needs. So tell me what specifically the foundation focuses on for the healthcare piece of this.
Our focus this past year has been very much directed on healthcare workforce. So not just OBs and physicians, but all aspects of healthcare workforce, because we know that Idaho is struggling in every area, every piece of healthcare workforce. And so we've been a part of leading a cohort, bringing many folks together to address healthcare workforce. And I know that that's been happening in partnership with the governor's office and workforce development. All of the universities, all of the major hospital systems have been a part of that. And Kendra Witt Doyle, our executive director at the foundation, leads that work for the foundation. And it's been really awesome. I mean, there are huge needs, and we have to figure out how do we not only keep the folks here in Idaho that are healthcare professionals, but also how do we build that interest in our youth and make sure that we have enough students that are not only going on to college, but have a career path in healthcare. One of the areas this year that we expanded, and it was new for the foundation, was we provided CTE funding to school districts that were building a healthcare professions program or expanding one of their healthcare professions programs, brand new. And as we got into that and opened up a competitive grant process, learned a lot, and we partnered a lot with the state to make sure that we were connecting in the right way, that we were focusing in the right areas. But when that grant opportunity opened up, I mean, it was pretty overwhelming, the number of grant requests that came in. One of the cool things that happened is Kendra was able to, we all took a look at the applications, but she was able to say, well, we don't want to limit, based on funding. We actually want to fund all of the qualifying grant applications. And so that's what she did. And so she moved funding within the foundation to make sure we were able to fund every eligible application for CTE. So it was from CNA programs to medical assistant to just starting a healthcare professions pathway in those districts. And the majority of the districts were rural that received the funding. So pretty cool, exciting. We're going to do it again this year, but that was also a tie over and a bridge into the education sector work. And I think that what's pretty cool about all of this is that we're seeing topics that are transcending all three sectors of work, and coming into this awesome Venn diagram of, all right, we know that housing is something impacting all three sectors. We know that healthcare workforce is impacting all three sectors, and we know that youth behavioral health is impacting all three sectors. And so that's where we're able to get a lot of synergy. And when we can come in and help facilitate some of those conversations and bring folks together around that, I think there's a lot of power of great minds coming to solve problems.
I think it's amazing that your organization was able to fund all of the qualifying projects for the CTE for schools around the state. I love hearing that. And in part because it's so important for our students in Idaho to see and understand different pathways forward and simply sometimes just be introduced
Right.
to professions that they may have never even thought or heard of before. And I think sometimes there is a bit of ideas that are taken for granted, especially as adults, that sometimes there's this assumption that like, well, yeah, there's the healthcare field and yeah, kids can know if they're interested or not. And mostly when kids think of the healthcare field, they're thinking of nurses and doctors. But there are so many components, there's so many roles within that field. I even think about like physician's assistants, PAs,
Right.
versus a nurse practitioner, our NPs. I mean, those roles, we're short on those, and we need those, immensely. I was actually just talking to a teacher in a rural area, and I think her husband was from Idaho and they moved up from Nevada. And she's an educator, and they moved up, and her husband's a physician assistant, and they moved to a rural area, and it was a great program that brought them there. And she loves it there. And they've been there, I think, for like 6 years. And I just think like, oh, I'm so glad that there are these programs that help people know what their needs are, incentivize them to come, and then keep them there because it's such an incredible place to live. And when I was looking at your website, I noticed there were a lot of universities that were participating
Right.
in different, it looked like scholarship opportunities for students.
Well, and that's absolutely true. I'm glad you brought that up, because as I kind of finished that part of the story, yes, we expanded this year all the way down to high school to start CTE opportunities. But there has been a lot of focus historically and especially now in regard to scholarships at pretty much, I think we're close to being in all of the colleges and universities. And a lot of that focus is on healthcare. And, we're a big partner of University of Idaho and also the WWAMI program, and making sure that Idaho students are able to get into the healthcare and medical fields, staying in Idaho. I know our scholarships at Idaho State University are healthcare focused in regard to mental health and behavioral health. And again, trying to keep our students in Idaho serving us into the future, because all of our healthcare professions are in a shortage right now.
Okay, so I want to go back to the WWAMI, because when I asked my husband 25 years ago, what does WWAMI stand for? I don't even know that he knew what WWAMI stands for. And it's like a term that everyone uses, but I don't even know if anyone knows what it stands for. So what does WWAMI stand for, Jackie?
So the Idaho WWAMI program is in partnership with the University of Washington School of Medicine. WWAMI actually is made up of the states that are a partner to the medical program. So it's Washington, Wyoming, Alaska, Montana, and Idaho. So that's what WWAMI stands for, WWAMI.
But what's interesting though is that Utah participates in that process too. University of Utah was in there. I remember when my husband was applying, maybe that was like, I mean, I think that's maybe the original name, and maybe they brought in an extra one, because I do know that University of Utah
I'm not as familiar with that.
at one
Right.
point was a part of it. Anyways, I know that this technically doesn't have anything to do with your foundation, but it's just something that's, I'm like, oh yeah, what does that stand for? So thanks for clarifying that for us.
Sure. Well, the foundation has been supporting the WWAMI program for a very long time, and huge supporter of making sure that our Idaho students have the ability to stay here in Idaho and can continue to practice in our state, and having that opportunity to join a medical school. So that's excellent. I know there are some Idaho students that our team has met. They're incredibly impressive from very small communities in our state, and I am just so encouraged to know that our Idaho kids are getting these kinds of opportunities and also want to practice in rural parts of Idaho too.
Yeah. So when we lived in Lewiston, my husband's an oncologist, and so he was at the cancer center up there, and he was connected with University of Idaho. And WWAMI's interesting because if students get into, say, and I think I'm going to say this right, if they get into the University of Washington for medical school, they actually do their first, maybe second year up at the University of Idaho before they then go over there. So my husband, all of us to say that like sometimes my husband would go give lectures
Sure.
for these students up at the University of Idaho. And what was so fun one time was that he went up to give these lectures, and my husband is from a small town, Idaho. And like he grew up in rural on a farm. And so he goes up and he, is meeting with these students, and a student comes up and is like, "Hey, like we're from the same hometown." He's like, "Oh yeah, like I knew your older brother." And so like the older brother had gone to medical school, and now here was the younger brother in the WWAMI program. And it was just cool.
That's great.
I love that kind of stuff.
Mm-hmm.
I don't know, where you
Wonderful.
where you get to connect, but it was helping a rural kid
Mm-hmm.
go through the program. So I thought that was awesome. Okay, so let's talk about your area, education. What are you focusing on in education, and how are you trying to help that area, and how do you know how to help that area? Like what to do in that area?
When I started out the foundation, just a little over 3 years ago, it really came in to learn a lot about the work at the foundation, but also take those factors that influence health and, view the education sector through that lens. We know that education is absolutely a predictor of health outcomes. And that all, starts with knowledge and opportunity. So taking a look at how could we build a comprehensive program through the education sector that supports, in so many ways. The foundation had a program and still has a program called Healthy Minds Partnership, and that is taking community-based clinicians and counselors and helping to partner them to provide services in schools. So it's school-located behavioral health. And we've really, taken that program and, tried to expand it as much as possible, but have met some natural barriers as we have in Idaho, knowing that our youth behavioral health crisis has far exceeded the number of counselors and clinicians that are available to provide the support for the families and kiddos that need help. And on the flip side of that, we had the opportunity to take a more comprehensive look at how could the foundation continue to support that program and expand work in the education sector. So right now, our three areas that I'm focused on supporting are, of course, youth behavioral health. Healthy Minds Partnership is one piece of the youth behavioral work that we're leading, but also community school strategy expansion, and then early education support across our state as well. And I have some pilot projects that I've started and tried to look at, okay, what does this look like, and how can we, fund additional support into districts? One of them looking at school nurses as well.
Okay, awesome. So let's break some of these apart a little bit. So
Sure.
when we're talking about youth behavioral health, you said something before we started recording that I thought was really insightful. It was about zip codes. And I think it was related to youth behavioral health. Do you remember what you said on that?
I think so. We know that your zip code or your access to healthcare programs, supports, and services, your zip code actually dictates your health outcomes more than your genetic code. And when you kind of think about that in the bigger picture, it's an aha of absolutely. So if you live in a small, far away rural community and you don't have access to all of the regular things that we kind of take for granted, living more close to the city center or more urban areas here in the state, there are definite barriers that come into play.
That, like, I mean, when yeah, like that's the second time I've now heard you say that. And I'm just like, your zip code, someone's zip code in like rural Idaho has more to do with their health outcomes than their genetic code does. That's what you said, right?
It is.
That really like gives me pause. I mean, that really gives me pause. And I think it's why I have seen so many people focus, so many organizations, state leaders focus on the need to support our rural communities with their various needs, particularly within that healthcare field.
Mm-hmm.
And it's just one of the things that I really hope are that when people are making decisions, particularly about concepts that are going to impact, our communities around the state of Idaho, that they're keeping that piece in mind. That's a really important piece that I feel like not enough people are aware of and are thinking about. So, I mean, when we're talking about youth behavioral health, how do you know what that pulse is? Who are you partnering with in that work? Just tell me a little bit, talk about that a little bit.
Absolutely. I do want to talk about that, Alexis, but there's one piece I want to kind of bring back to the zip code,
Yeah,
genetic code discussion.
please.
And really, the factors that influence health go back to where we live, where we work, where we play, where we go to school. And if you don't have access to all of the same opportunities, the choices you make are based on the choices you have available to you. And so that's how all of that comes together. When you have less choices because of where you live, and that then also goes into outcomes. That's the bigger picture piece of all of this. So that's how all of that, from our perspective, really ties together.
Mm-hmm.
And that's why you're seeing us focus, and there is a lot of focus, not just from us, but others across the state in regard to rural. So
Mm-hmm.
that's kind of the full story around that.
I love that. Thank you. I have been in contact and connection with so many different people who are focusing on that rural aspect. I mean, I say this a lot on the podcast. 70% of our school districts are rural,
right,
around the state of Idaho. 70% of our districts are rural. That's a huge number.
Mm-hmm.
And so this is why it's so important for us to be talking about it and thinking about it and making decisions that are also going to help our rural communities. The fact is, here in the Treasure Valley, we really benefit from our rural communities. We need them in all of their different forms and all of the different places that they are, because they provide really important parts to Idaho. And so we do have a lot of great things here, like in the Treasure Valley. And so I just think it's so important for us to be thinking about, it's kind of like what I tell my teenagers, like the world does not revolve around you. And so I think sometimes the Treasure Valley, we forget that the world doesn't revolve around us here in the Treasure Valley in Idaho, that there are so many other parts. And it's important for us to be community members, team players in this is how I think about it. It's important for us to be team players when we're thinking about the entire state of Idaho. I live here, but Idaho doesn't revolve around me, and I got to think about my other teammates too. I don't know. That's just how I think about it. Okay. Do you have any thoughts on that?
Well, I would say our rural communities absolutely support economies in our larger communities. I think of, I grew up in the Magic Valley. I've already said I grew up in Hagerman. It was a big deal when I went to Twin Falls as a kid. But I think of all of the small rural communities, as around Twin Falls as the epicenter there, and how they all come in for commerce and supporting industry and jobs, and also grocery shopping. And, we have communities in our state that don't have a grocery store. So your access and availability to healthy food is very limited. And a lot of times food is more expensive the farther out from the city centers that we get because of transportation costs. And this goes back to my knowledge and work, of course, at the Idaho Food Bank and understanding food systems and building out access to free food across the state. But families have to travel. Seniors have to travel. Everyone has to travel to be able to get food. And access to healthy food. And if you don't have that close to you, your choices are different. And that definitely leads to different outcomes especially if you don't have the financial means to access and buy the food that you need. So
Yeah.
that's just one example.
Yeah, I agree. I totally agree. So now let's move over into the youth behavioral health and
Right.
just talk about that. And how do you know what to focus on? How do you know who to partner with to address that? Because I feel like the youth behavioral health kind of, I mean, as you mentioned, I think it gets hit in all three of the categories: community, healthcare, and education.
Right, right. So upon starting at the foundation, I mean, I did a lot of listening and I did a lot of relationship building, and I traveled the state and talked to a lot of school administrators. I talked to Department of Education. I met with the School Board Association. I talked to parents, and I wanted to know what were their most pressing issues or concerns in the education sector. And across the board, the words youth mental health, youth behavioral health, our kids needing the help and support that they need, coming out of the pandemic, it definitely was exacerbated. But now what we know about the Idaho data and some of the research that we've been a part of funding is that Idaho's trajectory was already on the rise in regard to youth behavioral health crisis even before the pandemic. So, in the here and now, really, we already know that we do not have adequate behavioral health providers in the state, meaning we don't have enough. And I have said this many times, we are not going to counsel or clinician our way out of this youth behavioral health crisis. What we really have to do is we have to focus on, yes, we have kids that need help and support. Are they able to get access to the help and support they need readily and easily? The answer is no. And in addition to that, we have to build the right kinds of environments so that we have less kiddos needing access to youth behavioral health supports, services, mental health counseling, family counseling, and peer support work. So it's a yes and we have to come at it from all directions. I think for folks to understand that there are huge differences in our state in regard to access to behavioral health supports, but we have to also understand what is causing this. And again, going back to root causes. And there is an epidemic of loneliness. Even the Surgeon General has indicated that. But trying to understand what is it that our kids are experiencing that we may not know or understand, that could be leading them to have the feelings that they're having. And it really goes back to loneliness, isolation, sense of belonging. Mm-hmm. And unfortunately, in our state, Idaho chose not to move forward with the YRBS. And that was a survey. And for whatever reason or whatever, your thoughts are around that, we have to understand that we're making decisions based on very old data. And that data was collected during and before the pandemic. And those kids aren't in our schools now. We have to be understanding and meeting kids and families where they are. And that really comes back to understanding their thoughts, their feelings, and what it is they're telling us that they need. Well, the only way to really do that is talk to them, listen, and really some of that data can get easily collected through survey. Mm-hmm. So it's all of the things, and I say that, and I am not trying to be facetious, but this is a wicked problem. It's multifaceted and very complex, and there's no one perfect answer that's going to solve this. There are many things that have to occur for us as a state to get to a better place in support of our kids and youth. We partnered with the Department of Education and Superintendent Critchfield to do some youth behavioral health work. Also, we funded programs and projects to get a better understanding of what are the right kinds of things that could be supporting and building out those positive environments. How do we create better communities for kids? And in our work in youth behavioral health, I've really taken a look at this from a multi-pronged approach. I mean, we're continuing Healthy Minds Partnership. we need counselors and clinicians in schools to do the here and now work to support our kids that are in crisis. But we also have to get to that environmental factors and how do we build out support there. We funded a project in Marsing to bring on a school nurse because they didn't have a school nurse. Not all of our rural counties and communities have nurses that are available, but let alone school nurses that are, place-based. Many of them travel. But we funded a position through a partnership with Southwest District Health and Marsing School District, placing a school nurse in their community and really trying to take a look at what did kids understand about the role of a school nurse. And then there was a lot of really rich information and data coming about around the topic of youth behavioral health. Marsing has some very interesting things and supportive things that are happening in their community. And we'll talk about community schools and other parts and pieces that come together there. But as a result of some of the early data that was in information that was collected, we quickly identified, wow, there are opportunities to have a better understanding of what are driving some of the behavioral health needs for Marsing kids. And in doing that, we worked with Communities for Youth and Dr. Megan Smith at Boise State University, and they did a survey for their junior high and high school kids to really kind of dive into what's happening. How are you feeling about things? What are the things you're concerned about? Do you have a trusted adult? How do you interact with your peers? And there was some rich information that came out of that. I don't want to just focus on Marsing's data, but it was incredibly informative to the point that it allowed us to take a look at what was occurring in Marsing, how we could better lean in and support, how the entire community could lean in and support what needed to happen out there. And we wanted to say, how could this be applied to other school districts and other communities across our state? So long story short, that led to some really great work with Superintendent Critchfield and her team. Upon coming into office, she very quickly established a youth behavioral health team to start talking about what are the needs, how do we do a better job addressing those needs and get programs and services out there. That led to the creation of the Youth Wellbeing Assessment, or the Idaho Student Wellbeing Assessment. We are funding that work for Idaho this year. We have a few districts that have signed on to participate for free. This is absolutely a free service. The Communities for Youth will then implement the survey, take the data and information received, turn it back out to the school district. They own their data, and then they get to take a look at what are the highest priorities around youth behavioral health and what do they want to do as a community-driven. Family and parent engagement is a big part of that, and then build out the supports that are needed to start addressing the needs. There are themes that have come up in other surveys, but ultimately, like I said, it comes back to sense of belonging, sense of isolation, and feeling like they matter. And we have to really, lift up the work in districts to build this out. And obviously, you can tell I'm pretty passionate about what's going on here. But it's very complex. And, we're also funding other projects to take a look at what happens when you create overall better culture and environments in school districts. So we funded some work right now. It's a 3-year project with the school districts of Cascade, Notice, and Parma. We are partnering with them. They are working with Dr. Katie Acevedo and Results Learning Center to bring in PBIS, which is Positive Behavior Interventions and Supports. It's an entire system, K-12, that helps the district identify what do we need to do to build the right systems of support for all kids, all students, all faculty. How does that resonate out into community? It leads to better family and community engagement, but then also For kids that need a higher level of support, do they have all of the right supports and programs in place to help those families get connected? The key to what we're doing in those 3 districts is I intentionally placed that work in those districts because they are also emerging community schools. And community schools really are a holistic approach to meeting the needs of kids and families. And obviously, we'll talk more about community schools. But in regard to youth behavioral health, which is where we started, this is, as I said, it's multifaceted. We are not going to solve this overnight. There is no one thing that can happen to fix this, but it does go back to problematic access for families and children in rural communities. It's there. Not only are clinicians not available, but there are barriers within the system that are set up for families to be able to, just qualify for support to be able to get their kid assessed, and for them to then move on to counseling support. And I feel like systems aren't necessarily doing a great job talking with each other, and that's hard when the right hand doesn't know what the left hand is doing, or maybe everyone is, I think, with good intention, trying to do stuff and trying to do something, but it's not all necessarily integrated together to make sure that we're building out the right plan. And that's where we care, we want to help, we want to support, and provide the best information possible with the data and information that we have.
It is tremendous work, and it is tremendous that you care so much about it, and like the passion is there. I genuinely believe we need more people who are passionate about it or interested and know how, or just even curious, right, to how they can go about addressing that in their communities. I mean, there's a nonprofit parent group in Boise who, after the suicides that occurred in the fall of 2023, said, we want to address this for our kids in Boise. Right. And it's interesting because I'm connected to other school districts around the state, but I'm connected to a lot here in the Treasure Valley.
Sure.
And one of the things that I heard from this group and that I am trying to do some work around is it's the slogan, more social, less media in our school communities. And so when you talk about, hey, youth behavioral health is more than making sure that we have, counselors and those types of things. It's about building a system that is supporting our youth. One way that I really feel like I see schools doing that right now are removing cell phones and making it so that cell phones are not a part of the classroom experience. That looks different in every school. But what I actually was just talking to the superintendent of West Ada, and that's the largest district in Idaho. And he told me that after they started their policy district-wide of no cell phones, and it looks different in the middle school versus the high school.
Sure.
He's gotten over 500 emails of support from parents and students thanking him and the school district, the school board, for initiating that policy. Because when we talk about isolation and loneliness, people just kind of automatically assume because they're on their phone and they're looking at stuff and they're seeing pictures of friends that I think there's this assumption that it makes us feel good, but really doesn't. And I think it really does create more of a need to feel like you have to fit in. And Dr. Brene Brown talks about how fitting in is the opposite of belonging. And so creating these spaces where kids are interacting, where they're more social, where they're having conversations with each other, the phone is down, they've got eye contact going. I think that in these school environments now, there are more kids who are starting to feel connected to their peers. And I know that there are some principals in some of our districts who are intentionally trying to address some of these parts. So I just think it's so wonderful that this is specifically being addressed. I really like how you say we've got to create an environment where youth feel a sense of belonging. And quite frankly, I mean, adults need to create those. I mean,
That's our responsibility.
Yeah.
I mean, that doesn't just fall out of the sky. I mean, that's done with intention, and that's with the adults in the room. I mean, we are the leaders, we are the guiders, and we have to definitely support and foster, our youth to become leaders, and because they are, and they will become our future leaders as well. But we have to show up, and they are looking to us for that help and support. And it's not for them, it's got to be with them. And this is, again, power of listening. And we have to go back to meeting schools where they are, meeting communities where they are. But we can't just make random decisions. I'm a big believer in we have to look at what the information is telling us. And when kids don't have the skills that they need to be able to interact with their peers in a positive way, or even have the social skills to regulate their thoughts and feelings and behaviors, we have to give them what they need in order to be successful. And they're not necessarily going to get that off of a phone. But I don't want to get into the politics of phones. But what happens is kids have to have something to replace it with. And it's an easy opportunity for them to go to their phone if they're feeling isolated or uncomfortable. I applaud the districts that are working on this. This is hard stuff. And it's not easy for district administration or school board members. I mean, you have to really take a look at all of the information, synthesize that, and look at what is going to be the next best right decision for our kids at that time. And I think we can do it. And I know not everyone is always going to agree, but we have to find that middle ground to help our kids move forward. And this is really about future workforce as well. If kids don't have the skills that they need now, how are they going to gain those skills to be successful, not only in career and college, but, in the workforce beyond? So we all have to come together. We all have a role in this. And I see there's huge opportunity for us to make gains.
I'm so grateful that you said that we all have a part in this and we all have to come together in this work. That's how I view a school community, that we're all a part of this process. We're all included in this. This includes our neighbors, it includes the taxpayers, right? It includes, municipal leaders on that city level and on the county level. I mean, it's the teachers, it's the school board members, it's the parents and the volunteers and the students, right? It was just really sweet. I mean, it's the school bus drivers. I mean, my daughter said the other day, she was like, you know what? My bus driver told me that if I miss the bus and he goes down the street and has to turn around, he told me that I can just wait on the corner here and he'll be sure to pick me up. And I just thought that was so sweet. Like, what that told my daughter, not that she's ever had to do that. She's never done that. But what that told my daughter in that moment was that her bus driver cares about her. And,
right.
And that is so important for our kids to know that, that people care about them in all these different places that they are. That's what they need.
Right. Right. Well, and our kids have to have connection to caring adults. I mean, when we look at protective factors, that is one of the, biggest indicators of positive outcomes, is having connection to a positive, caring adult. And just even in that moment with the bus driver, I mean, each piece of this that comes into a school community matters. And, this is how we move it forward. This is how we make the work happen.
I love it. And that's like my phrase I use all the time. I'm like, I love it. I love it. So this then, I mean, really what you're talking about ties so much into community schools. So tell me why, how and why did you guys get connected with community schools?
Sure. Well, I'll start with when I started at the foundation and we started talking about what is the most comprehensive or effective way to affect health outcomes in the education sector. Well, my immediate response was, well, that's community schools. And the team was like, well, let's talk more about that. What does that mean? And what is community school? And I think that For our state as a whole, they are not as familiar with community school strategy. So, of course, I'd had some experience with community school strategy. It wasn't called, I wasn't working in a community school when I was in Pocatello School District, but the work I was doing was, now looking back, absolutely community school. In so many ways. And then there are some parts and pieces that are different now, but it was all about, connecting with community, connecting with families, building that bridge between home and school, making sure that our families felt valued and that the school also felt valued. And recognizing we all have a piece to come together to make this a success. So, community school strategy is really focused on bringing in all of the supports that kids and families need to thrive. And every community is going to be different, just like every community in our state is unique. Every school is unique. Every school district is unique. The needs in one community are going to be different than the needs of in another community. And that's the beauty of community school strategy. When they're doing the work and they're doing their needs assessments and they're listening to families, they're listening to kids, and they're listening to community members, that's where they can pull in all of the parts and pieces that really need to be centered and resourced, and building out the bigger perspective of the work. And it's everything from early education to career and college readiness, and all of the parts and pieces in between. Everyone has something to offer in community school strategy, and that's the part I love about the community building piece of that. I led some work in Marsing with their superintendent, and this was even when I was still at the Idaho Food Bank. They were in the early stage of moving forward as a community school. They had gotten connected to me at the food bank to put in a school pantry. Well, that was incredibly important because the food pantry in their community was closing. So this wasn't about a food pantry at their school. This was about a food pantry housed at the school that was going to support anyone and everyone in the community that needed access to food. And, in meeting with Superintendent Stewart, I was like, Norm, we could hold a community meeting and pull folks together and really do a needs assessment around what do you have in every area and what do you not have? And what could the community plug in and bring to the supports? And it was amazing. We held a meeting that had 45 leaders coming together to help us map out, and I call it community resource mapping, to map out what we had for 0 to 5, 5 to 12, 12 to 18 adults, and then also seniors. And we looked at all of the abundance that was in the community, but we also had to take a look at what they didn't have and then find ways to fill in the supports. And some really great things came out of that. And every community school goes through a similar type process when they do their needs assessment to look at, like, what do we need? How do we get there? Who can provide the support? And if someone can't provide the support, what can we do to build this out to make sure that the families have the support that they need here at the school? It's so cool. It's amazing.
Oh, I love the community school strategy model. I have really been taking a deep dive in it for actually my PhD program. And I mean, as the state PTA president, I get to sit on the steering committee for the United Way Treasure Valley, who's got that. They're the ones like harboring the grant and providing the professional development. And one of the things, so a couple of things. One, I mean, I've had Norm on the podcast. I was talking about how, what he's doing in his school district, and then also what that looks like out in Marsing, and what that looks like in Marsing is different than what it looks like in Idaho Falls. To your point, what's so wonderful about the strategy is that it is adaptive to meet the needs of the local communities. We need, particularly because Idaho is so, those urban and rural areas are so different, and there's, variability just within our rural areas. We need programs that are adaptable, that people can take and then fit to meet their needs. So that's one thing I love about the strategy. Another thing that I love, and that it seems like to me is really at the core of this, and it's interesting because I look at it through this lens of public administration, is that I believe it is a form of collaborative governance. Meaning that when we're looking at how we're governing our areas, this strategy, the framework that it centers around, provides continued professional development, but then the concept of we have someone coming in here, we're gathering the data, we're working together as a team to figure this out. We're presenting data maybe back to our parents saying, this is what we see. Is this what you see, right? Let's come together and make some decisions. Now, admittedly, working in a collaborative way can be a little slower sometimes, right? We're not making these super fast decisions, but to your point, it actually, I think it saves time and resources in the long term when we know how and what is needed, right? Like what is needed and how we can figure out and address those things. So, and then to me, community schools fits all three categories for what like the Foundation for Health is working towards, right? Community, education, and healthcare. It addresses all of those things. I listened to when you and I had connected like a month or two ago, you had said, hey, I really want to connect you with Dr. Megan Smith. Like, I think you really got to get connected with her. And then my like producer here, Matt, was like, hey, I met this woman named Dr. Smith. Like, she's really cool. I was just hearing about it, when you hear those things. So then I actually went to a totally different function. And she's a professor at the university that I attend. And so that wasn't how I even like met her. I just happened to be at an event that this group from Boise was putting on. They're focusing on mental health, and Dr. Smith was one of the presenters. And I was like, this feels so, I had a professor, he uses the phrase kismet. I was like, this is so kismet. Like this, I've been hearing about her. This is awesome. So in her presentation, she talks about like her working with community schools and how in like one of the schools, as she was like presenting the data, it was like, they were spending so much money on vape prevention, and that's important. Like, we don't want our kids on vaping, okay? But they were spending so much money on it. And when they did that survey, they realized that there was a far bigger problem going on and that they really probably should be addressing that problem. And when they addressed that problem and did their year-long initiative on that, they made huge gains in addressing that problem to where if it was 2/3 of the population, it shrunk all the way to 1/4 of the population.
Correct. I know that data, and I know the district you're talking about, and it's phenomenal, right? And I love being able to use that opportunity to share out, like, here's what happens when you start thinking about things differently, and to me, that's what community school is all about. When I started my role at the foundation, I really came to talk with like-minded partners around how can we further support community school strategy. Community school is alive and well here in the Treasure Valley, because of Boise School District and United Way of Treasure Valley and their funding footprint and supporting community school work. But I said, hey, as a statewide funder, what can I do to bring additional partners to the table to take a look at how do we expand this amazing concept outside of the Treasure Valley to other regions of the state? And we created a collaborative fund and a collaborative group of funders who were interested in expanding community school strategy, wanted to put our funding and support to that, and also some guidance and leadership around how can we get to other regions, how can we get to other districts. And in collaboration with the Idaho Coalition for Community Schools that is housed at the United Way of Treasure Valley, and they provide that backbone support for the Coalition for Community Schools, we've been able to lift community school strategy, get a community school up and operating in at least every region of the state. And what that did was allow for Idaho to prepare and get ready to write for the federal full service community school grant. We were unsuccessful the first year that that grant was submitted. And I'm so grateful that we didn't get it the first year, because honestly, like, looking back, we weren't ready. But with all of us coming together to lift and support the work, it really set Idaho up to be ready to receive the grant. And the second application through the Coalition for Community Schools, as you know, was successful. We received a $46.5 million award for over 5 years to expand community school strategy with a focus on rural expansion. So that's amazing. Holy cow.
Yes, 100%.
Yes. And we have all of the right partners at the table, and we still have room for more partners, which is fantastic. But this, and we're on the statewide steering committee together for the Coalition for Community Schools. And I'm also on the Rural Expansion Committee as well, because I'm all over the state, and I am very connected in with our rural school districts. And so really, knowing who is ready and could move forward with an opportunity like this. We are currently in the process. Letters of interest were submitted. We had 16 districts apply to move forward with community school strategy. We're right now in that process of evaluating those, and we'll move forward. Instead of with an application process, it's probably going to be more of an interview process to vet out which districts are going to be able to be accepted in for the expansion. It's highly competitive, and it's limited. We can't bring in everyone, because we have to be able to use that funding over the course of the next 5 years. And yes, $46 million is a lot of money. But at the same time, when you break that over 5 years and you look at supporting up to 50 schools, and helping them to hire a community school coordinator, those funds go so quickly, right? And so we're excited and incredibly hopeful, and also wanting to make the case and build the knowledge of community schools, what they do, what that means, and look at how can Idaho invest in this in a more long-term way after this 5-year opportunity. And that's the big picture of where we're going and why. But the reason for us as a foundation, it was really why is community schools the right choice, and why is it that we want to put our money where our mouth is when it comes to health and health outcomes? And that's because community schools do school a little bit differently. And they're looking at things from a very holistic perspective, and it's really rooted in the whole child model. So meeting the needs of the whole child, and that means engagement with the community, engagement with family-centered decision making, and that doesn't get any better than in rural Idaho. Our schools are often the center, the epicenter or the hub of the community. And it doesn't matter, who you are, you're showing up for those Friday night lights, or, the sports events, or the community concert that's happening. And that's how community school is different. And I see huge opportunity in our rural communities, because they already approach things in this way. And this is why, we believe that this is an excellent opportunity to lift great work in Idaho, but also provide that level of support that many of our rural counties and communities need.
I agree with everything you're saying. It's really, to me, just at the center, it's just really beautiful work. And I like the word that you use, holistic, just in that it really is bringing in all of those parts, and particularly in our rural communities, that's how they operate. I mean, I remember talking to a school board member from Genesee, and she was kind of talking about what they do, and my kid's principal in Lewiston was from Genesee. And I just saw him recently and my husband reminded me, he was like, wasn't he the mayor at one point in Genesee? And I was like, yeah. And he's like, and didn't he wasn't he like the, EMS like director for a while? And I was like, yes, he was. And he's like, all while he was also working for the Lewiston School District. I was like,
Yep.
yes, that's And just so like
Welcome to Idaho and welcome to rural Idaho. Yes, right.
Yep. And I remember when I was like the PTA president at the elementary
Mm-hmm.
school and I was getting to know the principal. And I mean, I was also on the school board at the same time. I just loved hearing his stories about what it was like to live in his community and what it meant to him. Like he loved it. And sometimes it was hard. Like sometimes it was frustrating. You got these, community members who've been there for a long time. I mean, there's feelings that can sit there. And he talked about, I mean, there were just some really funny stories, some really heartwarming stories, and some really amazing stories about his experiences being in his community. And I mean, he's still doing it. Like he still lives in Genesee and he still works for the Lewiston School District and, what he does for the Lewiston school community and then what he does for his school community in Genesee is incredible. Right. And he's not like one isolated person, right? Mm-hmm. There are those people all around the state of Idaho. And what I like about the community school strategy also is that I feel like it is like an intentional way of bringing those people together. Right? So they're not kind of out there like isolated. They're working together to address this in that collaborative way. And that's what I love.
Mm-hmm. Yeah, you nailed it. It's really about local driven work. I would say one of the terms we're using to talk about community school strategy right now, especially in regard to rural expansion, is it's hyper-focused on the rural community and what it is they want and need. And so it's local control, local decision making. These families are a huge part of what they are going to do to shape the strategy that their district wants and needs. But you have to do that by listening. You have to do that by being inclusive. You have to be able to pull together, neighbors and other community members and the teachers and the kids as well, because that matters. We need to know what they think and what they care about and what they want to be a part of and what they believe the needs are in their school too. And coming at it from all of those, bringing those parts and pieces together, I think is super important. And that's very much an Idaho way. And I think that has kind of gotten lost a little bit because this is really how our rural communities work. And having grown up in a rural community, this is how it worked. I mean, these are all of our friends and neighbors, and they ultimately do care about how the school is doing. They care about how the kids are doing. And by bringing together all of these parts and pieces and plugging in the right supports in the right way, we're able to lift the work. And ultimately what that means is we want more kids being successful. We want kids and families thriving. We want kids graduating, and we want kids going on to college or with career readiness. And that's what leads to the bigger support for us, as Idahoans, and what this means for legacy in our communities.
This is one of the reasons I love living in Idaho. I didn't grow up in Idaho, but I grew up in a small town, and I grew up on a farm. And as you're describing what it means to you to grow up in a rural community in Idaho, right, where you're there and your people and you know them and you're working together. I grew up on a road where just right down from my grandma. And on that, that was the home that my dad grew up in. And at the end of that road was a 2-room schoolhouse. And all of my aunts went to school there. I don't know that my dad did. At that point, they took that road that I lived on and those kids, and they brought them into the little bit bigger, like just the town, right? That's just in the town. And as you describe what it meant to you to be in that rural community and to know your neighbors and all that stuff, I mean, I just think about growing up on that road, and as we would drive around, it was like off the highway. And as we would drive around, my dad would say, oh, those are those people, all the highway, all the way into town. And I just, to me, like when you're talking about like what it means to be an Idahoan for you and like what it means to be, to like tap into those values, I think that's one of the reasons I love the community school strategy because I feel like it harkens back to what our communities care about, like what are those foundational things, and that they can come together to work on those and build, really build those back into and help the kids understand and help the adults understand what those things are. So that is, I mean, it's just, to me it's such a beautiful strategy, and I have like such beautiful feelings when I think about what is happening and then the potential for what is to come. I just, anyways,
Right.
that's what I'm thinking.
I think the important piece of where community school strategy goes next, right? We're
Mm-hmm.
bringing on the next cohort of new schools that are exploring strategy and will be funded to move forward to hire coordinators. I think that's super exciting. It's going to be transformational. And these, it's not that we're looking at things from a place of scarcity. We have to look at the positive that the district has and that the schools have, and what we're going to do to layer in and build upon the great foundation that the district already has. Every school district has these bright spots, and I think that sometimes that gets overlooked. And there's lots of opportunity to move this forward. And there's a great video that our foundation funded to talk about community school strategy. You can go to our website and take a look at it. But it focuses on Harwood Elementary in Rigby and how they do community school in that school, and in comparison to Cascade School District and how they do community school. And that's the uniqueness and the beauty of it, because it's, again, looking at what does this school need, what does the community want to need, and what are we going to do to build in all of the right supports. American Falls has some great work happening and going on. The community of Genesee is also amazing in what's happening in Genesee School District. Now, they're district-wide because they're all in one building, right? But still very awesome things happening, and they're looking at, and how do we do this better, and what do we do next, and what are we missing. That's going to be different for every school district, because every school district has resources that they bring to the table, and their community has unique resources that they bring to the table. So where we go next, I mean, is pretty exciting. And recognizing we're in year one of a 5-year process, and there's an evaluation, of course, attached to this work, to be able to look at the sustainability, the outcomes and changes of what happens with intention and great decision making. How do we compare to from where we were to where we are now, and what's the secret sauce in that? Well, I think it goes back to it's kind of simple. It's leadership. It's thoughtfulness. It's always trying to make the next best right decision for our kids and families. And how do we help lift them up? And what do they need? And that's going to be different in every community.
Amen, because that is exactly what Idahoans want to. Like, and I know as an adult, like I don't love to be told what to do. And so that is like something else that I love about this, is that like it's a way for communities to assess what they need and how they want to address those needs.
Right.
And I just love it.
It's collaboration at the center. Mm-hmm. Collaboration is the key on all of this. And it's the collaborative decision making that is really going to lead to the successful differences in every district. Mm-hmm. So I think that's pretty great.
I love it. So I'm going to make sure that like in the show notes, that video that you talked about, I'm going to link that into my show notes for the podcast. Where can people go if they have ideas for a potential grant, that like if they've got an idea or they want to connect with you? What's the best way for them to do that?
If folks are wanting to connect or just learn more about Blue Cross of Idaho Foundation for Health, go to our website. There is an inquiry that you can make through the website, and it's okay for folks in the education sector to reach out and contact me. Um, right now, we there's one time per year when there's really an open grant kind of opportunity. But for the most part, we're focused on what we're focused on, and obviously always open to ideas. But right now, the best thing to do is go to our website. If you have questions or want information, inquire through the website. And if it's education sector, you can reach out to me directly.
I am taking away from this conversation the work that you're doing is really intentional to help our school communities around the state of Idaho. And it's so important for all of us to be intentional in the work that we're doing. And how we're interacting and how we're engaging in what is going on. And I so appreciate the work that you guys are doing because it's tremendous and it's making such an important impact in the state of Idaho. So thank you for the work that you're doing, Jackie.
Well, thanks so much, Alexis, and I appreciate the opportunity to be here and talk with you about and share what we're doing and the why behind all of that, and just knowing that we get to be a part of this and moving our state forward in such a positive way is very fulfilling.
Thank you.